And welcome back. Well, many people assume that lingering aches and pains are just a part of getting older or maybe just a result of an old injury. But there's actually a surprising connection between hormones and pain. So today we've got an explanation plus what you can do to find lasting relief.
Stacey Roberts is a master's prepared nurse. She's a physical therapist, author, and owner of New You Health and Wellness. She wrote a book. It's called The Pain-Free Formula, and she joins us now with what she's learned from her own experience with soreness that just will not go away. It's great to have you here.
Yeah,
Thank you.
good to see you.
Thanks for having me. This is awesome.
Yeah, we're excited to have you in studio. And you have talked before about this knee injury that you have. If I remember right, you were out showing off your stuff polka dancing.
Totally. I was rocking it out on doing the polka. And my knee just kind of, big, huge snap in my knee, pop, and searing pain. And I had to limp off the dance floor. And my son was, kind of like, what's going on with her? And then I had SoftWave at my clinic, which I've talked about on the show before, that took care of it. But then all of a sudden, a couple other things started happening, and I'm like, what is going on?
Yeah. Yeah, it kind of led to a shoulder injury.
Yeah, I was literally sitting at the front desk with Stephanie, our front office manager, and all of a sudden, we both heard this noise go.
No way.
And my shoulder literally dropped. And I'm like,
just standing there.
Sitting there, yeah. And she said, what was that? I said, I don't know. Did you hear that? Because sometimes you think you just hear it in your
own head.
Yeah, and literally it was one of the bursa on my shoulder was torn and a little bit of tendonitis and things like that. And it just happened all of a sudden. I'm like, what is going on? So as I talk to patients about hormones, and I'm, at the time of my knee injury, I was in my mid-50s, and then a couple years later with my shoulder injury, later 50s. So then I started looking at hormones, and sure enough, my estrogen was low and progesterone, obviously, in postmenopause, but my cortisol was also low. So all those are anti-inflammatory when they're in good levels. So basically, I had minimal natural anti-inflammatories in my system to help. So when I was working out, when I was doing things and kind of overdoing it at times, doing a lot of travel and under a lot of stress, my body was starting to talk to me.
Well, and here's the thing. We know that taking over-the-counter anti-inflammatories, whether it's ibuprofen or acetaminophen, isn't so great for our gut health and a lot of other things. And you don't want to take those anti-inflammatories to combat that. And I've been dealing with joint and muscle aches for years now. It must be hormone related. And I think people just think, oh, I'm getting older. I have to just put up with
normal.
this. And it is so frustrating, especially if you want to be active.
Yeah, it's very, very common, but it doesn't have to be normal, right? So there's so many things that we can do to help with that, especially if we kind of preparing ourselves for that time of life. We don't really prepare ourselves for postpartum, where hormone changes like crazy. We don't prepare ourselves for perimenopause. We just kind of get stuck into it and then are lost. And we don't prepare ourselves for menopause. So that's what we help people do at the clinic, with helping to optimize their hormone levels and treat the area that is injured or potentially inflamed.
Yeah.
So when does this happen? Because one thing I've noticed in my 40s is that it can change with stress levels or life changes, or if I lose sleep for a little while, that maybe things sort of flare, it feels like. And then I just think, well, I just need to correct those things. Is that an age-related thing, or is that these life stressors related
It's
thing?
really a perfect storm of everything. So all the things that we could do in our 20s and 30s that we still try to do in our 40s and 50s as far as activity and even stress level, and sometimes stress level obviously increases in the 40s and 50s, things like that. Combine that with the lowering of hormones that we have. For women, it's more natural to have that lowering of hormones. That combination is the perfect storm to set up for those types of things. And our generation is wanting to be active for longer. So we're still out there playing. We're still out there lifting weights we were talking about during the break. And we really have to be aware of how we're doing that so that we don't injure ourselves or set ourselves up for injury because of the change in hormones. And it's even all related to the gut, which I know, everybody loves for me to talk about gut and foods, but that really has a significant impact on our joints as well.
Well, and I think a lot of people are listening to this and they're thinking, oh, that's me. If you have hot flashes, it's perimenopause or menopause. But this joint and muscle aches is so kind of nondescript, and it can be anywhere. Shoulder, knees, hips, backs of legs, like the glutes, ankles and feet. It can be everywhere, and it can move. And I think that's why people are like, what's wrong? Is it my lower back? Or is it my knee?
It comes out of nowhere sometimes, it feels.
It really does. And what people don't realize, especially perimenopause, is hot flashes everybody talks about, right? We always associate that with perimenopause or menopause. But joint pain is actually more, in some studies, is actually more common than hot flashes for women in that stage of life. So again, it gets kind of pushed off as, you know, oh, I hurt myself 20 years ago and now it's just kind of coming back because I'm getting older. That's not necessarily true. So we really need to do an evaluation to see where is this coming from. And when we deal with the biomechanics, use our SoftWave device, if it's not going away after a couple treatments, we start to broaden the possibility of where it's coming from so that you're not doing 10 or 12 or all these different treatments that aren't going to really help you in the long run. So we really try to narrow it down and then look holistically at the person as well.
So you can determine if it's structural, if it's hormonal, and you can supply help for both.
Absolutely. Yeah.
Good to
so
have
you do some hormone testing, I'm guessing.
Yeah, we do hormone testing, and we assess that. Now, we're not looking for abnormalities that would cause medical conditions to treat. Then we would refer out if we've found something like that. But if it's just balancing things, looking at lifestyle, looking at food, looking at gut, looking at activity, how you're moving. We had a patient recently who came in, significant back pain, went to physical therapy, had even worse back pain, but it wasn't correct. They weren't correcting how she was moving and how she was doing the exercise. So we actually had to back off on the exercises, restart, and then choose the right ones for her particular body. And then also look at what she's doing in regards to her eating plan, what her hormones were looking like, and try to help her balance that naturally. We also are going to be partnering with a company called Momentum Health, which is a subsidiary of New Health and Wellness, that's going to be providing HRT to women who need that. So we'll have a nurse practitioner or a physician reviewing people's information. So if somebody does want to look at utilizing HRT to help them, they have that option too.
Wonderful.
Hormone replacement therapy.
It's a lot of good stuff there, Stacey. You got to get it figured out because you want to be active, you want to feel good. And right now, Stacey Roberts from New Health and Wellness is offering a consultation for just $99, so you can truly understand what's happening in your body. They're going to look at your history, your symptoms, your stress levels, and whatever hormones may be playing a role, and they're going to map out the next steps that work for you. No guessing. No random supplements, just clarity. Give them a call. The number is 414-299-8121. Again, the consult is just $99. That's 60% off the normal price.